My name's John. I'm a general dental practitioner who limits his practice to children and paediatric dentistry. Orthodontics is becoming more and more prevalent between adults and kids being treated, and the expectation is that as a general dentist you need to know about orthodontics to see if you're referring on, or a lot of the time patients want you to take a role in their treatment as well. So it gives you the knowledge and the background to carry out these cases with confidence and more knowledge. From this programme, the main things that I've gained are the more you know, the more you need to know. Orthodontics is a very complex specialty, and I think when you first pick it up, you feel like you can start to manage certain cases, but then as you start to learn more, you become more interested and you want to dive deeper into it. And the more that you find out about it, the more you want to know. In terms of the training, the most valuable aspect is the amount of case discussion you have. You learn the background, you learn the theory, but there's an awful lot of case discussion in different cases from other delegates in the course. So it's not just hand-picked ones from the people that are taking the course, it's our cases that we see day to day, and seeing the pitfalls that you can run into without even realising through other people's assessments and treatment. With my practice, this course has been very beneficial because I see a lot of kids who are developing dentitions, and there's a lot of variation that you see now. Some need early intervention, some need intervention later in life, and some want to know what will happen if you don't intervene. So rather than having to refer out in every case at every time, you can have that initial discussion with people and then take on cases that are relevant, and even those that are referred on, you can then actually get them back in and see them after and actually have an idea as to what treatment's been carried out and take over their care in a more informed manner. Almost every day now I'll see patients, and a big part of my assessment for my referred patients is the orthodontic assessment. So there's not a patient I see these days that I don't do an orthodontic assessment on and give an opinion in that way, so it literally changes what I do every day. With the orthodontic training, retention of patients and engagement of patients has been much higher. The fact that you can have an initial discussion with the patients and seem more informed about what has always been a specialty of its own increases patient confidence, and it's one of the most commented things on with parents of the children that I see, that they're glad that we're taking that into account from the off and they don't have to go for a second opinion straight from the get-go. If you're on the fence about enrolling in this programme, I would say that definitely go for it, because it's one of the few courses that you can implement to almost every patient that you see every day. So in terms of value for money for the course itself, it is something that you'd be able to apply straight away in your daily life and daily job. And it's also really beneficial to your patients because you'll start to see things differently and treat all cases with an orthodontic mind, which I think is really valuable for going forward.